Hello, my name's Brenda Vincent. I'm the Service Manager of Equals Advocacy. Part of our role is to help older adults to plan for their future care needs. We assist them to complete anticipatory care plans. We've been working very closely with the team. The GP practice identifies people using the e-Frailty tool, and advocacy holds that first initial conversation.
I was wondering, could you tell me, Agnes, why did you want to do an anticipatory care plan?
Well, as you know, I have a diagnosis of dementia now for 14 years. And about 4 or 5 years ago, I started to experience severe respiratory challenges, which resulted in me getting paramedics to my house and emergency admissions to hospital. And this is not good for people who live with dementia. And it's much better when it's not a family member, I feel. And when Donna read it through, or I read it over the phone to her, she was amazed how we got all the relevant points in the way we done it, because there's not a lot of space.
You were very clear in your anticipatory care plan, Mrs. Houston, that reducing hospital admissions was something that you absolutely wanted to happen, but also if a hospital admission was necessary and unavoidable, then you wanted to be treated very quickly and returned home for further care and support. I know also that when you were doing your anticipatory care plan, you highlighted who was important to you and who was important in your life.
There's a relief, not just to me, which is fantastic, but my daughter, she's in England, so she feels relief that whether she's there or not, and while she's to come to me, that this is there. So it is written down.
So after watching the film, I hope you can see why it was so important for Agnes to complete her ECP. So what can we learn from this test of change that we've been involved in? We've had to adapt and change our work around COVID. This has been a challenge, but hasn't stopped us proceeding with this test of change. Probably one of the biggest successes that we've had is we've extended the advocacy role to include frailty assessments. The information provided is richer and helps the team and the MDT to focus not only on the ACP, but other necessary inputs. Here is a snapshot of the process for one individual. Following the anticipatory care plan and frailty assessment, Lisa brought back to the MDT some of the findings. After a lot of discussion, it was decided that there would be an increase in home support. OT assessment was arranged. A home safety visit by the fire brigade to put in place fire retardant bedding. Continence assessment was required. It was highlighted that the falls team need to become involved because there was a risk of falls, and an emergency carer support plan was put into place. So what still needs to be done? We need to reach out to more older people using this approach. We need to consider if these frailty assessments could be undertaken by all advocacy workers in the community, because they provide so much intelligence and feedback to GP surgeries. We need to use the evidence, feedback and information to improve the process, and most importantly, to continue to monitor and evaluate the differences made to the older person's journey. What matters to me, it's really important that we actually use the person-centred approach. Stop me getting into hospital. If I go into hospital, make it timely and safe. Don't let me get stuck, and let me die with dignity.